Hi, my name is Jennifer Ortega. I'm going to be doing the colostomy care video today. I have my student ID on. I have plain gray scrubs. I still don't have my Nightingale scrubs. I have hand sanitizer for hand hygiene, a pair of clean gloves. This is going to act as my stoma paste, 2 washcloths, my stoma guide, and this is going to act as my trash. I'm going to go ahead and introduce myself to the patient and explain the procedure first, and then I'm going to turn the camera around so that you guys can see the actual stoma. So the first thing I would do is knock, knock, open the door, close it for patient privacy. Hi, my name is Jennifer. I'm going to be your nurse today. Can I get you to confirm your first and last name and date of birth for me, please? The patient would provide the information. I would double check with the wristband that everything matches and then move on to the next step. All right, Mr. Smith, it looks like the doctor wants me to go ahead and change your colostomy bag today and just kind of clean and assess the area. Is that okay with you? Patient verbalizes understanding and consents to the procedure so we can move on to the next step. Okay, so the first thing that we would do is perform hand hygiene. And we're going to glove up. Okay, we're gonna remove the pouch first. If there's any liquid waste, we would go ahead and discard of it in the toilet. If it's solid, it would just all go together in the trash. Okay, so we're gonna dispose of this. Next thing we're gonna do is remove the faceplate by lifting towards the stoma itself. Okay, so we would dispose of this. I'm gonna set it off to the side because we're gonna need to reuse it along with the bag. All right, so now that we got everything removed, we need to go ahead and clean the area. So we're gonna take the first washcloth. I'm gonna be dipping it in warm water and an improved solution. So dip, 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 pretend it's there. And we're gonna cleanse the area like we did with the wound care videos. So from the inside, work your way out in a circular motion. Okay, done with that. Then we're gonna go ahead and dry the area. Same thing, circular motion from the inside going out. Okay, we're done with that as well. Next, we're going to assess the skin and the stoma itself for any irritations or anything that's going on, any concerns. So the skin looks nice and clean, no redness, no irritation. The stoma looks great. So we can go ahead and move on to the next step, would be, which would be measuring it so that we can put a new plate on there. So here's the stoma guide. I made a couple of holes already. This one is too small. It's too tight around the stoma. And this one is too big because it's loose and you don't want the fecal matter to get all over the skin and cause irritation. So we're gonna go with this one right here, which is the 1 3/4, which fits perfectly around it. All right. So now that we know what size we're gonna need, we're going to apply the stoma paste and let it completely dry before applying the new faceplate. So this is the stoma paste. We're gonna go ahead and put some around the stoma and we're letting it dry. And once it's fully dry, we can go ahead and attach the new faceplate. So it's already pre-cut because I've been practicing. It is a 1 3/4 of an inch. All right, the new faceplate is in place. Now we're gonna take our pouch that we're reusing from earlier because I only have one. I'm gonna open it just so that you guys can see how I would close it. So this is the opening right here. Oh, come on. This part's the opening. So what I would do is twist it couple times and then use this metal to just kind of bend it back and create a seal. So now that our bag is closed, we can go ahead and apply it. So it just clicks into place. All right, and the heat from the patient's stomach as well as my hands would kind of help seal the area with the paste as well as the sticky stuff on this. All right, so new bag is on, so we can go ahead and remove and dispose of these gloves. We're going to perform hand hygiene one more time. All right, I'm gonna ask if the patient needs anything. Mr. Smith, it looks like we're all done here. Do you need anything? Do you have any questions? Are you comfortable? Patient doesn't need anything. Patient states they are comfortable. Perfect. I'm gonna go ahead and step out. I'm gonna close the door behind me to ensure privacy. And last thing we're gonna do is go document the procedure as well as let the provider know if there was any concerns. We didn't see any immediate concerns, so there's nothing for us to report. So we're just doing the documentation and that's it. Thank you.